Good morning, and thank you for joining us here on the Morning Medical Update. I'm Jessica Lovell. It is summer, and just like many of you, we are working hard to bring you some fun and exciting shows come fall. This morning, we are bringing you a rebroadcast of one of our favorite shows. If you have any questions, please leave them below. We will answer them during our live broadcasts on Monday, Wednesdays, and Fridays. So sit back and enjoy this Best of Morning Medical Update.
Hey, good morning. It's Wednesday, October the 20th. I'm Dr. Stephen W. Stites, the Chief Troublemaker here. Chief Medical Officer here at the University of Kansas Health System. This is Open Mics with Dr. Stites, coming to you live from the Dolph Simons Family Studio, where we are broadcasting live on Facebook and YouTube. Welcome back today with us on this beautiful fall morning. Gosh, it feels good to say fall. You may have beaten COVID, but you may also notice that you're getting dizzy, suffering heart and breathing problems months afterwards. In fact, some COVID-19 long haulers may actually be dealing with a known condition called, here's a lot of big words, Postural Orthostatic Tachycardia syndrome. It basically means you're getting lightheaded and your heart's going really fast. We have one woman's emotional story on her road to recovery from POTS and what you can do if you are just like her. In a moment, we'll be checking in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control at this morning's numbers. He's dropping off his kids. But we're going to turn to this story and start the conversation. But first, do we have any reporter questions today?
Yeah, good morning. Cody Holyoke with Channel 9.
Cody.
Hey, good morning. So the White House, just a little while ago, actually, came out with their announcement on the potential rollout, the expected rollout for Pfizer vaccines for kids ages 5 to 11. And what struck me was interesting. They were really going to be leaning heavily on pediatricians' offices, local pharmacies, and even schools. And they even made a point of saying we're not really going to do the mass vaccination events that we typically did with adults. I'm curious your thoughts on that, because it's a little bit of a different tactic, but again, a different age group too.
It is a different age group, and I think for a couple of reasons. First of all, there's just not as many kids in the 5 to 12-year age group as there were adults and those who are 16 and older that could get it, right? So you just have fewer numbers. Second of all, it's pretty clear that the reason parents get their kids vaccinated is often dependent upon their relationship with the pediatrician and their chronic, whoever is their normal healthcare provider. That trusting relationship, that doctor-patient relationship, goes a long way on how people receive information and thoughts about going ahead and proceeding to vaccination. So I think it makes a lot of sense to actually do it this way. Third, I think that you really have plenty of infrastructure with what's being used to deliver it effectively. Fourth, I believe that we are better off now with our supply chain. Remember, one of the reasons we tried to do it through mass vaccination clinics was the storage requirements for Pfizer and Moderna. Since those have been loosened a lot, and because most of us now have a successful supply chain, and with me today is Brandon Kupfer, one of our general medicine docs, who also works in the long haul syndrome. And you may even comment, Brandon, we're giving a lot of, I gave vaccination in the clinic yesterday. At the beginning of it, that wasn't possible. We had to have all this very organized approach because of the sub-zero temperature things, et cetera. But now we're pretty well organized to give these vaccinations any place.
Yeah, I completely agree. So we're giving a lot of them in our clinic every single day now, and I think you're right. So, this is, people want to have questions about the vaccine. They want to make sure that they're making the right decision. Having that relationship, having that conversation with their pediatrician is going to be key. And so I think it's a great idea that they're doing this through the pediatricians' offices. And pediatricians, they give a lot of vaccines anyway. So a lot of vaccines happen in childhood, and so I think they're really well equipped to
yeah, they're well prepared, well experienced. They do a great job, and I think it's absolutely, to me, that's absolutely the right strategy.
Yes. And then on that note, what's being done behind the scenes to prepare for this? Because, the White House is coming out and saying, it seems like it's going to happen. You're looking at all the data. Looks like it's going to happen. What's being done behind the scenes to get ready for this?
Yeah, we've spent hours making sure our teams were ready for this. We've been giving vaccinations to those 12 and above, so we really wasn't that much of a stretch to get us ready to do 5 to 12-year-olds. And I know folks at Children's have been working overtime to get their clinics ready. We're ready. But I think it's really just been about making sure you had your supply chain in place, making sure that all the folks were well acquainted with the information around us so you could answer questions, and making sure that you have the correct clinic flow set up so that when people people do get a vaccination, they can be observed for a while after the vaccination. So, but it's something that we're pretty good at by now with the COVID vaccines, and I think it's just, you know, we're taking this one in stride. In the great world of COVID-19, this one is an easy get relative to some of the other challenges we've had, Brandon.
No, absolutely. So, yeah, we get vaccines every single day. Once we got that kind of supply chain figured out, we started rolling out. Our practice managers are really good about working through the workflows. So.
Yeah, my answer is bring it on. We've been ready to do 5 to 12-year-olds forever. We are delighted to be able to get that opportunity and looking forward to the announcement, hopefully really soon, maybe at the end of this week or early next week, that this is going to move forward. Other questions?
Dr. Seitz, I have one from Fox 4.
Hi, good. All right, what do we got?
Okay, so Caitlin is asking, as soon as today the FDA is expected to allow people to use a different COVID vaccine type for the booster than they use for their initial doses. So this is according to the New York Times. Have you read this report? And in your opinion, how would the mix and match benefit us?
Yeah, this is great. This is the mix and match approach, which really just makes everybody kind of mixed up about what we're all going to do now. And I think that we have been following this pretty closely. You know, for those of us in the COVID world, we've been following the information that's been coming out about this for months now. And it started coming out of Europe and then in the United States. And then there have been a number of studies that have been looking at what is the right approach. And, you know, for example, let's look at the J&J data, right? J&J comes out, they say, here's another shot. We can boost your antibody levels by about a factor of 4 if you take the J&J. But wait, if you took the Moderna vaccination after the J&J, when your antibody levels went up like 67 times, and if you did the Pfizer, it was like 30 or 40 times. And so, you know, there's emerging data that says that mixing and matching is okay and may be advantageous. But I say that, remember, here's what we know. We're following antibody levels. And we're saying that antibody levels are a surrogate marker, meaning that it's giving us insight into how well your overall immune system is responding to mix and match. Now we're trying to also look at data about outcomes. How well protected are patients if they've mixed different vaccines together? For example, you took the J&J and then you did Moderna, or you took Moderna and then you did Pfizer. I think what we're seeing is that there may be some advantage. I was trying to figure out how to describe this, and so I thought I'd come up with one of my typical Stites awkwardisms. So, you know, let's say I don't know how to match my colors and my clothes very well, and I'm going into this very colorful room, and somehow I want my clothes to match the room. What do? Well, I just mix my colors up on my clothes a little bit more, which is sort of geeky and awkward, and that's what I would do, right? Because I'm kind of a dorky guy. But then all of a sudden, I can match the colors in the room pretty well because I matched my colors and I did a funny thing. Well, think about vaccines in the same way for just a moment. Imagine that you want all levels of immunity. Each vaccine does a little different job to help induce your immune system just a little differently. So if you mix them, you might get a broader defense against any possible ways that COVID-19 is trying to hurt you. So that's kind of the way it looks. And so there is some logic behind mixing and matching. By the way, it's much more scientific than trying to do color matching in the way I would do it with clothing. But the idea behind it is still very real. So I think we're going to see that there will be emerging data that suggests that their mixing and matching is okay. I don't think it's going to be required. I think all are going to help reduce hospitalization and death, which is the ultimate goal. But I think that there may be some advantages. My guess is we'll see it more with the J&J vaccines because they only got one dose to start with. I think we're going to see some advantages to mix and matching. This, for example, if you do J&J and then following it with Moderna or Pfizer. I think there's a lot more we have to learn about, but I do believe that the government is going to say it's okay to mix and match vaccines. So then what do we recommend to patients? And I think here's my answer. The first thing is complete your initial series as required. So let's say you're getting your first shot's Pfizer, get your second shot of Pfizer 3 weeks later. And by the way, if you've had a transplant or you're on chemotherapy, get that third part. That's the series of vaccinations. That's different than the booster. Then, if you want to go get a booster, work with your primary care or whoever your physician is to say, what do you think is the best decision for you? Here's what I'm going to tell my patients. I'm going to tell my patients, you know, I'm glad you had the J&J. That's a great form of vaccination. When it comes time to do the booster, I'm going to recommend you get either the Moderna or Pfizer booster. What am I going to recommend in 6 months after that? I don't know. But I think initially I would probably recommend it just because the antibody levels go higher and we think there may be longer lasting immunity. I think if you've gotten Moderna up front or Pfizer up front, I think you can flip a coin about Pfizer or Moderna as far as whether you want to mix and match, and I'm comfortable going either way. But I think that what we're seeing so far is that really all the vaccinations are enormously successful at preventing hospitalization and death. I think it's okay to mix and match. I don't know that we can give you a completely solid recommendation about which is best for everybody, but I think you can talk to your individual healthcare provider about what might be best for you.
Dr. Stites, Nathan from Channel 41 is passing along a question that he had given to him by a viewer of theirs, asking if you all could update him on those over 65 who are wondering what is going on with the Moderna booster. He says, I don't think I'm alone here, and we are considered high risk. Are we just getting left hanging?
No, I think you're going to end up getting a booster. I just don't think the FDA has made their official final recommendation yet. Their advisory committee has made a recommendation. The CDC advisory committee meets, I think, Thursday and Friday this week. So I think by either this weekend or by Friday or early next week, we're going to hear what the booster recommendation is going to be. And I think it's going to be that you get it. It's going to look just like the Pfizer recommendation. It's going to say at 6 months, you get a get a booster. And I would say to you, it'll be for those over 65, those with chronic health conditions, and frontline healthcare workers. I think that's how that's going to play. I would say that it remains to be seen if we'll get a half dose of the original one or the full dose with Moderna. I think it's going to be half dose, but we won't know that until we get the final data. And again, we'll know that by the end of this week or early next week. And just to tell you, I know, and I'm sure all hospitals and all providers, and Brandon, I bet you guys, we're totally ready to give that booster as soon as it's out.
Oh, of course. Yeah, we're ready to go. Once we get that final approval, once we get that green light from everybody, we're going to be giving it. And so, yeah, we're getting a lot of questions in our clinic, in the general medicine clinic, about this. People are anxious to get that Moderna booster, and I get it. I got Moderna, so I'm in the same boat.
Yeah, let's go. Ready.
And so as soon as we get that final approval, we're ready to go, and we'll give that out.
But remember this about the boosters. If you get into the fine print, remember that Moderna and Pfizer are still preventing severe hospitalization and death. So they do a great job of that, and J&J as well. I should have left that out. What the booster is really doing is trying to help prevent you getting any degree of COVID and preventing COVID transmission. It may improve how sick you get. We're not as sure about that, but clearly, because so far, even at 6 months out, you still have protection against severe hospitalization and death. So when they tell you the Pfizer effectiveness has dropped down into the 30s or Moderna's dropped down into the high 80s, what they're really saying is your ability to get any form of a breakthrough infection or to transmit it, you're still very well protected against severe hospitalization and death. We see that here every day.
That's it.
All right. Well, Jess, you also have another part of this coming up now. You're going to join us with one woman's story about her long haul symptoms and how that really affected and changed her life.
That's right. We're glad Dr. Comfort is here because we talk a lot about long haulers, get a lot of questions about that here on our program. And here's somebody that we'd like you to meet.
I was 29 years old and I had no pre-existing conditions. I'd never needed medication for my body.
Mikayla Dreyer went from young and healthy to desperately sick, all because of a post-COVID viral syndrome that developed long after her COVID infection went away. Now, unfortunately, doctors say stories like this are becoming increasingly common. A new study just released by Penn State College of Medicine finds that more than half of the world's 236 million COVID patients can expect to suffer from long-haul symptoms for 6 months or longer. But Mikayla has found hope thanks to the help she got here at the University of Kansas Health System's post-COVID clinic. Alexis Del Cid shares her story.
Mikayla Dreyer thought she'd done everything right. She was so healthy, she hadn't even taken a single sick day in more than a decade. She works around children in schools all day long, so she thought her immune system was as tough as they get, until she got COVID and her entire world turned upside down.
I'm just not much of a sit around and do nothing kind of person.
At 29 years old, Mikayla Dreyer was enjoying an incredibly active life.
I was a long distance runner, so I like to do 5Ks, 10Ks, and even half marathons.
When the pandemic hit in March of 2020, she was also in the process of becoming a mom to 2 small children.
I was hypervigilant from the start.
Then one day at the end of December, she woke up with a tickle in her throat, and we all know how this next part goes. The tickle became a cough, the cough became a fever, add in a racing heart. Then Mikayla lost her sense of taste. She got tested, COVID positive. Mikayla's fever took 21 days to break. After that, she had trouble breathing, walking, sitting, talking. It was terrifying.
I was 29 years old. I'd never had to be afraid that I might not wake up in the morning because I wasn't going to breathe.
Days turned to weeks, weeks turned to months, and the symptoms multiplied, now including chest pain, fatigue, muscle weakness, and tremors causing her to lose her grip and drop things constantly.
I knew I had COVID, but I didn't know why I was having all of these symptoms.
After 5 months of suffering, Mikayla got a referral to the University of Kansas Health System's post-COVID clinic, a special clinic for long haulers, where she finally didn't feel like such a medical mystery.
Everything I described, they had heard it before.
And she finally got a diagnosis. Mikayla was diagnosed with something called Postural Orthostatic Tachycardia syndrome. It's a mouthful, and it's most commonly known as POTS. Doctors say typically they see someone with POTS who has suffered a traumatic injury, something like a brain injury, meningitis, even pregnancy. But now more and more often, they're seeing it in their COVID patients. While under the care of post-COVID specialists, Mikayla developed more alarming symptoms. Numbness in her hands and feet, and dizzy spells so severe she had to rely on a wheelchair. But at least she had doctors who told her they knew why it was happening, and they had a plan to get her on a path to recovery. And equally important, they gave Mikayla validation at a time she was feeling as if she was coming unmoored.
I felt heard, and that was really, really big.
Finally, by late August, 8 months after her initial symptoms, Mikayla started improving consistently.
So what would you say to the doctors at the long haul clinic who have finally been able to give you some answers and some relief and some progress?
I didn't expect that to be an emotional question. Thank you for listening and, trusting me and the other long haul patients when we're telling you that something's not right. And honestly, I don't even know if they realized that they were giving as much hope as they were.
Today, Mikayla is down to her final week of physical therapy, her resting heart rate in the normal range, and she can push her kids in the stroller without issues. While that is miles away from her pre-COVID life, Mikayla knows she's getting there step by step. Mikayla says she's also hoping her POTS is gone within the year, but she says that's still the unknown right now. She's also very hopeful of her trajectory, so hopeful that she's booked a cruise for the Bahamas this fall and has a kayaking excursion planned for when she's there in November. Now that's something to look forward to. I'm Alexis Del Cid. Back to you.
Well, thank you very much, Alexis. And Mikayla, we're going to join you in just a minute. And Jess, thank you. We're going to come back to you for some community questions first. Hawkeye, you got some numbers for us?
Yeah, not as good. We are seeing kind of an uptrend, which I'm not really happy about.
No.
22 active infections, 9 in the ICU with 3 on the ventilator. Two total patients of those 22 active infections are vaccinated. We still have 27 in that recovery period. And Hayes has 8 active infections and 4 in that recovery period. But I should say, I believe we do get transfers for COVID as well. So
we do, although we're not able to accept as many as we did last fall because we've been so full. So we'd be higher than the 22 if we could. We'd probably be closer to that 30, 40, 50 range. And I think that's an important point because we don't want people to have long-haul syndrome.
Yeah.
We don't want people to get sick. But I think we've hit this baseline. What we have to be careful with is what happens as things get colder. People move inside, and if mask mandates go away. What we're seeing in northern reaches of the United States, it's in the northernmost counties, even in places that are highly vaccinated, is an escalation in cases as people begin to move inside more. So that's what we have to be careful about because we don't want to have people have the kind of situation that Mikayla has. Mikayla is joining us now remotely, and in our studio is Dr. Brandon Comfort, who's going to talk to us more about this syndrome around long haul. But let's start with Mikayla. First of all, Kayla, thank you for telling us and sharing your story. That is.
Hey, I'm glad to be here. Thank you for having me.
Well, we're glad you're here. How are you feeling today?
Not too shabby. I've certainly been on the upswing lately, so having a pretty good day so far.
All right. So when did you first notice these symptoms, and how did you hear about the whole long haul syndrome?
The long haul symptoms, I started to notice after my initial COVID infection. About a month later, I noticed that a couple of my symptoms, the chest pain and my racing heart and my trouble with some breathing, hadn't improved at all. And so I noticed that after the first 4 weeks after the infection, and just kind of monitored it with my primary care physician, and noticed that it didn't improve. And then it was joined by some other symptoms as well. I initially heard about the long haul clinic on the radio, actually. I believe it was the KCUR was doing some sort of update from this show, actually, and one of the doctors had mentioned that there was a post-COVID clinic opening at KU. And so then I talked to my primary care physician about how to get into that and if that would be an option for me.
Yeah, and I bet it sounds like it's good that you got there and got into it. And then there's some other long haul clinics in the area too, and I think it's really important that patients get to that. Talk about the treatment you underwent, and I bet it was a little exhausting, but I think you expected that may be the way to beat the symptoms.
Yeah, so treatment has been not all at once. I started on my first medication in March, which was about 8 weeks after my initial infection. I started taking a beta blocker to control my blood pressure and heart rate, both of which were still elevated 8 weeks later. And that was March of 2021. And then after my symptoms kind of continued to escalate in May, when I first heard the term POTS, I had a nurse practitioner recommend some lifestyle changes, including increased sodium and salt and increased hydration, as well as like compression garments to kind of help promote blood flow. And then they prescribed physical therapy. So I did 3.5 months of twice weekly physical therapy. Dr. Husleg at Select Physical Therapy was the absolute best, and it was intensive. And the first several weeks, all of our exercises were done just laying down, because my body, anytime we tried to even do any sort of exercise while sitting up, much less standing, my heart rate would just skyrocket and I would get dizzy and start to pass out. So we had to start all laying down. And then gradually over time, we worked through a protocol for patients who have POTS symptoms that has now kind of been adapted for some long-haul COVID patients. And we worked through a protocol and gradually started sitting up while exercising, and then eventually standing, just to kind of retrain my body how to manage stress. And by stress, I just mean any kind of physical exertion whatsoever. So I was finally discharged from physical therapy super recently, but I still have an at-home physical therapy regimen that I'll be doing for a good while yet. And treatment has been a lot of trial and error, what works, what doesn't, and lifestyle modifications that I did during the worst of things when I was using a wheelchair and a walker to kind of help keep me stable, because my muscles were so weak and shaky, and I was prone to pass out at any time when my blood pressure started going crazy or my heart rate was skyrocketing. So it's been
that's
a roller
big
coaster.
deal. That is a real roller coaster. So are you able to get out and walk around and move around and do things now?
Yeah, totally. I only used some mobility aids there for about 3 to 4 weeks at the worst of my symptoms this summer, and really wild to see how even just a couple months later, how much has changed with the help of medication, which we've adjusted and increased dosages of, as well as the physical therapy program. And now I can go for walks and some very gentle, easy hikes. And hills and stairs are still a beast. I don't know if that's ever going to get easier. I still lose my breath doing those things, even though I'm making a lot of progress. But I have much more regained a sense of normalcy in my lifestyle compared to where I was 3 months ago, 8 months ago.
Good. Now, did you get a vaccine as well after all this?
I did. I actually, because I work in the schools, I was eligible for a vaccine on day 8 of my actual COVID infection. So I just barely missed my window. And after 21 days of isolation, I signed up for my vaccine and I got my first dose the week after I ended isolation. And then I got my second dose a few weeks after that.
All right. Well, good. I hope you stay healthy and safe, especially when you go on that cruise. Make sure you keep that mask on when you're inside. Make sure you wear that mask when you're inside that cruise, and if you can, get a booster before you go. Just a thought. All right, Brandon, talk to us a little bit about what POTS is, and tell us a little bit about Mikayla's story from a medical standpoint.
Yeah, sure. And before I answer that question, I just want to say thank you again to Mikayla for sharing that story. It takes a ton of courage to come on something like this and share that, but such a strong advocate for our long haulers here.
Absolutely.
So it's so important to hear from our patients.
And it does take courage, especially when you're dealing with kind of strange people like myself.
You're not that bad, don't worry.
And I love how you highlighted our physical therapists. So just to give a shout out to our physical therapists, occupational therapists, speech therapists. They're the most important members of our post-COVID clinic, just like what Mikayla's saying. They really helped her kind of get back, and it's continuing to help her get back. So POTS, as we mentioned, it's a mouthful, right? So postural tachycardia syndrome or postural orthostatic tachycardia syndrome. What this is ultimately is some sort of impairment or dysfunction of our autonomic nervous system, right? So this is a part of our nervous system that we don't ever have to think about. It regulates things like our heart rate, our blood pressure, whether we sweat or not, all these things that we just kind of take for granted. And so for reasons that we don't really understand, in patients with POTS and other viral infections, it can affect that autonomic nervous system. And in particular, with patients when they're having postural changes. So like Mikayla was talking about, when she was standing up or trying to be active, her heart rate was spiking up, right? And so this is, our heart rates all increase a little bit when we stand up. That's normal. Our blood wants to go down to our feet because of gravity pulling that down. Our body compensates for that by raising our blood pressure or raising our heart rate up a little bit to compensate for that. But in patients who have POTS, their heart rate doesn't go up 5 or 10 points like yours or mine does. It might go up 40, 50 points. We've had patients come through our post-COVID clinic where when they stand up, their heart rate gets 150, 160. We had one that got up to 170. And so when your heart rate's beating that fast, you don't feel
good. No, you don't feel good.
You might feel lightheaded, dizzy, feel like you might pass out, other things, concentration, focus, fatigue, etc. So all these sorts of symptoms can kind of come down the line on this. And it seems to all tie back to that autonomic nervous system.
Yeah, people, and how long does it take to recover? And has everybody recovered so far?
Yeah, people do recover. And so, a lot of times this goes on for months to years. But we do know that people with POTS from other things, so non-COVID related POTS, that we do see a lot of them improve. About half of them probably have full resolution of their symptoms within a year or two. And so we're hopeful that this is going to be similar with our patients who develop POTS after having COVID.
And sometimes your heart rate can go, your heart rate go up, and sometimes your blood pressure drops. Sometimes it goes higher. It's kind of goofy what can happen in the autonomic nervous system. I think typically we've seen it in patients who suffered from traumatic brain injuries, concussions, post-concussion syndrome, childbirth, meningitis. Why are we seeing it now with these long-haul patients, do you think?
Yeah, we don't know the answer to that, of course, but we do know POTS. This is something that we've seen many times. We see it every year, right? We see it after somebody gets flu. We see it after EBV, Epstein-Barr virus infections. It's reported in Lyme disease. The difference this time around is just the sheer number of patients, right? So I think Jess mentioned earlier 180 million people around the world that are having long-haul symptoms 6 months later. Even if even a small fraction of those patients are having POTS, that's going to be a huge number of patients, and it's going to be difficult to get all those patients seen.
Yeah, so this is just one more reason to be vaccinated, because I think the data is getting stronger and stronger that vaccination, even if you get COVID-19, reduces the risk of long-haul syndromes.
Absolutely. So at least cuts it in half. So.
Yeah, I mean, we have good data to support that.
And it makes it milder. If you do get it, not only does it decrease the numbers, but it also makes it much milder, so and more rapid recovery. So I think clearly vaccination is an important adjunct to the treatment for POTS. Mikayla, what's been the greatest challenge for you? Especially, you have 2 young children, is that right? Holy cow.
Yeah, I'm actually a foster parent, so I did not have children during my initial infection, but I do now. And the greatest challenge has been, thankfully, prior to having 2 young kids running around, but the greatest challenge has just been going from, being perfectly healthy and capable of doing physically pretty much whatever I wanted to do. I mean, certainly I didn't just wake up one morning and run a half marathon, but I could train to do that, and I could go hiking or paddle boarding, or, if my friends had a crazy idea.
Oh, she froze on us. I think she was about to say, if my friends had a crazy idea, I was going to go get crazy with them.
That's exactly right.
And I understand that thing, and I do that as well. That's perfect.
Am I back?
Mikayla, yeah, you're back now. So for those, I think one of the hard things for people with a chronic illness like this that we don't always understand, and that people can't look at you and see. It's one thing when they can see you in, crutches or whatever, but if people look at you and say, well, you should be well, what's wrong with you? Did you find that even in your social circle, some people didn't understand what was going on, and that kind of feels a little isolating?
Yeah, definitely. So I worked summer school in June and July, and during summer school, that month or so was when my symptoms were kind of at their peak, so far at least, and hopefully it stays that way. But that's also when I was using a wheelchair and a walker. And so these are people that I had been working with for a long time, and then all of a sudden I'm sitting down and not really able to get up and move and do the things that I usually do without using that kind of mobility aid. And it was a big shock. And a lot of people at first were like, what are you doing? You just taking a spin? And they didn't really understand. No, this isn't for fun here. I'm not doing this because I want to. I'm doing this because if I stand up to try to do my job, I might pass out, and then we're going to have a lot bigger problem on our hands here. And so it was difficult, and physically I'm up and moving around, and people can't feel the way that my body feels when I'm struggling to breathe. And when I would drop things, people would think, oh, you're just clumsy. And I am by nature a clumsy person, so they're not wrong. But this was more than that. This was, I physically totally lost sensation in my hands, and now there's a broken plate on the floor. And then I don't want to have to, change the whole conversation and make it about me and all these physical medical things that are happening. So I just kind of laugh it off and move on with my day. But inside I'm like, this is so frustrating because I don't have control over my body, and other people can't physically see what's happening, but they can see that something's happening and they don't know what it is. And then I have to deal with kind of the emotional and mental, do I want to talk about this right now or do I not? And how do I make those decisions, and how much do I share with which people? And, how do I avoid making this a thing that it doesn't need to be, while also being honest about my experience and getting, the accommodations that I might need in order to make sure I can go about my daily activities.
Yeah, that is hard. So, well, thanks again. As the Dr. Conference, thanks for being a part of this program. Thanks for hanging in there with that long haul syndrome. I'm glad you're better.
Absolutely.
Did you say you're jogging at all right now?
I'm not jogging. I also have arthritis in my big toes. Probably developed from a lot of my long distance running experience. No, not from that. The arthritis was prior to COVID. So I haven't been jogging. I'm just walking right now and pushing the stroller up hills and getting ready for my kayaking excursion. A lot of my physical therapy, we specifically were targeting upper body stuff because that's more difficult for breathing, since the upper body movements are close to your lungs and heart. It requires more exertion from those organs. And so I'm doing upper body exercises as part of my at-home physical therapy in preparation for my kayaking excursion in a couple months.
All right. Well, good luck with that. Well, Jess, let's see what questions you were getting out there from the community. I bet we have a couple, maybe a lot.
Okay, we do. And I'm just going to tell you, this is why I love the people who watch our show. This may not be the most important question of the day, but it's certainly my favorite. Veronica says, first of all, she loves this conversation that we're having today, but she asked, has anyone ever told Dr. Stites that he looks like Jeff Goldblum?
Yes, I have heard that, and Joe Montana and Daniel Craig.
Wait, who
I'm
did
not
I
sure
tell
who I'd
you?
rather look like the most.
Who did I tell you reminded me of last week? Do you remember?
Spock. I don't remember. Who
No,
was it?
I told you reminded me of John Lithgow.
Yeah, John Lithgow. I don't know if that's a great... Thanks a lot for that.
I love him.
Yeah, he's another big goofy guy like me.
It's Stites biopic played by John Lithgow.
Please, John Lithgow.
Let's get his agents.
Holy cow! Can we find a more handsome guy?
Talk to his
I
people.
like the Daniel Craig comparison myself.
Fair enough. Fair enough.
I'm not sure if it's very valid. This is why I'm getting compared to Lithgow. Thank you very much.
Sorry. Okay. Okay, so Dr. Stites, the White House unveiled its plans to roll out the COVID-19 vaccines for kids ages 5 to 11, pending the FDA approval. So we're getting a few questions about that. So let me ask you this. Christy wants to know, she says, my child is 11, will be 12 in December. We do not want to wait to get the vaccine for the adult dose due to holidays and winter months. Will he get enough protection from the children's dose?
That's a great question, actually. That is a great question. You know, gosh darn it, Hawkeye.
What do you do in that?
What do you do, and then what booster are you going to get?
Yeah.
Here's what I would speculate. I would say go ahead, but then when you get the booster, you're going to get a full dose booster 3 weeks later.
I think that's the way to do it. You know, again, we're talking more about immunologic age, not necessarily birth date age. And is there a significant difference between 11 and 12 immunologically? I mean, for most people, that's prepubescent, pre-adolescent. So I think you're probably still there with the immune system. It's probably the same whether you're 11 or you just turned 12, but I think that's probably the right answer. Get your dosing at your age when you can, but then for those people, and I'm sure there's going to be a number of people who are in that that second dosing, their age changes, I would probably go get that dose that is age appropriate at that point.
Yeah, I'd try and get that full dose one, and I think that's probably the way to go. And I think you'll get plenty. The truth is, you're going to get a great immune response, and you'll be really well protected against severe illness and death. And that's really the goal. The data I was looking at last night said 93% reduction of severe illness and death, and that's 12 to 16-year-olds. But I think we can extrapolate into those even younger, perhaps, and I think it's going to go great.
Yeah.
Anil wants to know, does the monoclonal antibody treatment also lower the percentage of getting long haul syndrome at the same rate of getting vaccinated does?
Yeah, that's a great question, Hawk. What do you think?
I don't have a good answer for that. I would hope and assume, because I think what we have a lot of the etiology of the cause of the long haul syndrome, and certainly Dr. Comfort can correct me, is probably a lot of that immune response that is kind of gone haywire or gone awry. And so if you can get to that virus and treat that infection in the very early stages to help prevent some of that immune overreactivation, that may help. But I don't know that we have necessarily numbers.
So do you have thoughts about that?
Yeah, so we don't have data on that yet. I haven't seen any publications on that, but I can tell you anecdotally, you know, we got to be careful with this, of course, but we're not seeing a lot of patients who got the monoclonal infusion in our long haul clinic. We probably need to run the data ourselves just to kind of see where that is, but there hasn't been anything published that I'm aware of.
In fairness, we haven't had that many we've done a lot of monoclonal infusion. There have been a lot more COVID positive patients, so the numbers will be bigger. But I'm not hearing of any. Have any of you? Yeah, I'm not hearing that.
And I was going to say, our N is pretty small. Our number is pretty small compared to the number of infections out there, but we have given 887 doses of the monoclonal antibody since the beginning. So
wish we'd given a lot more if we could get more people interested in doing it, because it is a really effective therapy for preventing, 85-90% reduction in hospitalization and death is pretty effective therapy once you already have COVID, but you got to get there early. Jess.
So Anil has a comment and a question for Mikayla.
Hi, Anil.
Hi, Anil. Yeah, I know, and he's also a long hauler as well. It's definitely an emotional roller coaster. Many days it feels like 2 steps forward, 1 step back. But he says to Mikayla, as long as you keep moving forward, one day you look back and realize how far that you've come. So what have you done to handle that frustration of not being all the way normal yet?
Therapy. I have no shame in letting everybody know. I see a mental health therapist as well as the physical therapist that I did, and I was doing that prior to my COVID infection, prior to my long haul, and during my treatment. that was really helpful for me to kind of process the changes from going to healthy to being someone who manages a chronic illness and still tries to get back to her normal life. So I can't say enough that I think therapy for everybody always. Reach out and talk to somebody. It's hard. It's exhausting. It's isolating for sure. And the best thing for me has been being able to talk to somebody who can help me work through that. There's also some online support groups for long haul patients that have been really helpful for me in kind of talking with other people who, some of them have similar symptoms and some of them don't. But what we all have in common is this uncertainty around this novel virus and kind of how long it will take to get back to normal, and just kind of sharing that camaraderie with others who are going through something similar was really helpful too. So I think the biggest thing is just finding support within your community through professionals and other people, and that was super helpful for me in managing the ups and downs, which are fewer, but they still happen for me too 10 months out.
You know, my one piece of advice I'd throw in there, and you can comment because you take care of a lot of patients chronically. I take care of a chronic disease patient population with CF for transplant. And one of the rules of thumb I used it up in the ICU. We have all these rules that I had up in the ICU, and one of them was sometimes it just takes time. People always want to see a rapid recovery, like, okay, I just had my appendix out, I can get a lot better. But that's not how a lot of disease works. A lot of disease causes an injury, and it takes a long time to repair that injury, and your body does repair it, and so sometimes it just takes time. And then I think, Mikayla, you said it well earlier. The other rule I try to educate with patients is that where you start's not where you finish. As long as you're seeing progress, and you can look back and say, "Gosh, I've actually made a lot of progress," to Anil's point, then you can feel good about where things are headed. If you hit a plateau and you're on the same plateau for a month, then, or 2 weeks or whatever the time is, then you have to sit and think, okay, what do I need to do differently to try and get me headed back in the right direction? But as long as you're seeing improvement, you can look back and say, actually, I'm better than I was a week ago. I'm better than I was 2 weeks ago. Mm-hmm. You are headed in the right direction, and that flips back. Sometimes it just takes time. That's a really important rule, I think, to teach folks.
Yeah, absolutely. And actually, we encourage our long-haul patients every day. We say, don't look at this in days. Don't compare to yesterday, compare it in weeks or months. And more times than not, we're seeing improvement in those big chunks of time. So I think that was incredibly well said. And obviously getting our mental health professionals, we have psychologists on our team here that we try to get everybody connected to. So it's absolutely critical as people get through this recovery.
Yeah, if you need some more help with that, I hear that John Lithgow is available there, Jess.
I'm going to find a really handsome picture of him, and I'm going to send it to you.
No, that's okay. Good luck. You're going to have a hard one. I'll take Daniel Craig or Joe Montana's back.
Okay, I'll let you get by with it. I'm just keeping it real, but I think he's handsome. Okay,
listen. One of my patients wrote a story about me, and she said, yes, and she was talking about how, we're in the CF clinic where there's a physician and a nurse, so I work with Joyce Funk, I nursed 20 years, poor girl, and she's been stuck with me. But she said, I was the waffle, and Joyce was the chocolate chips. So listen, I've been called worse. I've been called a waffle too. It's hilarious.
Okay.
I love that comment. I am sort of a waffle.
I'm going to find a good pick. Okay, so Dr. Comfort, Melissa wants to know, are you seeing any teenagers with POTS?
Yeah, great question. So I think the answer to that is yes. So I don't, as a general internist, I see patients 18 and older primarily, but down in the pediatric clinic, I do believe they've seen some.
They have.
I think you guys have had Dr. Nelson on before.
Yep, absolutely.
So, yeah.
Okay, Phyllis wants to know, says my last vaccine was in March. I had COVID in September, had antibody shots. When should I get my booster shot?
Oh, that's a great question. Hawkeye, generally we're saying if you've gotten the monoclonal antibody infusions and you've had COVID, you can wait a little longer.
Wait 90 days, yeah.
Yeah, 3 to 6 months, I think is sort of thinking, so.
Okay, Brittany wants to know, do you think parents will have a choice of which vaccine their child gets? I mean, if Pfizer comes out first, do you think they'll just grab that, or do they wait?
Yeah, I think Moderna's behind on this one, and I don't think you're going to. I think if you're looking for either the 12 to 18-year-old group or 12 to 16, because you can always get Pfizer at 16, or if you're looking at the 5 to 12, Pfizer is pretty far ahead, and I don't know that FDA had asked Moderna for more information regarding the dosing strength and the issue of myocarditis, which appeared to occur a little bit more with Moderna than Pfizer. So I think, and that may be dose related. So I think that we're still a ways out from having Moderna be available to young groups.
Yeah, I would definitely get
Pfizer.
The first one that's available. And I think, some of this reason, we talked about this yesterday on the chairs meeting, Steve, just under opinion and recommendations and circumstances, we are getting into colder weather. We are going to be meeting. People are going to be gathering for the holidays and get-togethers. You are going to have that maximal protection now as soon as they are able to offer the vaccine to those children. If you can get them vaccinated, you will start to gain protection prior to Thanksgiving if it's offered early in November. By Christmas, everybody should be maximally protected if they get their second dose. This will help reduce that chance of transmitting it, especially to those people that are higher risk of severe disease, if you are meeting with family and doing things more like the pre-pandemic stages where you are having larger family gatherings and things of that nature.
All right, Jess, just one or two more questions here.
Okay, I have a reporter question for you,
Please.
John, over at Fox 4. Do doctors believe mixing and matching will simplify the booster rollout?
It's not going to simplify it. I think, we had a question about that before you came on Hawkeye today, and just saying that I think that the mix and match is going to be, I think we said it's going to leave everybody a little mixed up about what to do, and I think there's more to learn, there's more to be said. It does look like the FDA is going to say it is okay to mix and match, and there may be some special circumstances. We gave the example of the J&J vaccine where they want you to mix and match. Some of the transplant programs around the country are now saying, I know one in particular that told their J&J patients to get a Moderna vaccine after that, and that would be a mix and match. So I think there will be some of that. I don't know that it makes it easier until we get past the confusion, though.
Yeah,
and we don't have any shortages of any of the vaccine.
Correct, and I'm not sure really what is the clinical ramifications of the mixing and matching. Certainly in some of the basic science research, especially with AstraZeneca and then Pfizer. Again, we don't have AstraZeneca here. We do have Johnson & Johnson, which is similar to the AstraZeneca. It showed very good and safe outcomes. So I think, and again, we talked about this too yesterday, 6 months down the road, I'm not sure a lot of this matters. I think the important thing here is to go get vaccinated. And those people that are wanting to keep up to date and do the best practices, I don't have a concern about them because they will either talk with their medical provider, they will talk with trusted sources. It's those people that still haven't gotten any vaccination that I'm more concerned with. And so I'm really continuing to push just getting that first and second dose of vaccine rather than the booster, because those people that do want to do best practices and keep themselves healthy, do this for their community, keep their community healthy to help reduce the prevalence of the disease, I don't have a concern about them. They'll be able to get the information and be able to get the right dosing. It's really those people that haven't gotten anything.
I think that's right, and I think but it doesn't really make it easier. If you want to get a booster, there's going to be plenty of booster available. Yeah. So I wouldn't be nervous about that.
Jean wants to know, with colder weather coming on, what are your recommendations about indoor dining at restaurants or indoor dining and parties at hotel dining rooms with large numbers of people? Should we be living it up over the holidays? Yeah. What do you think?
Well, you can live it up if you want. I just think you're going to pay the price afterwards, and Santa's not going to be very happy with you. Because I think what's going to happen is we're going to see another surge, and hopefully it won't be like the last one, because either from vaccination or some immunity because people had COVID-19, we won't hopefully see quite as big a surge. But I think the problem is that we still have over half of our people that are not, or about 48% of the people in our metropolitan area are not vaccinated. Some counties are higher. And I think if people go inside the holidays and they're not outside and they take the masks off, we'll see the beginning of another surge. Just as we are, reports yesterday about some of the northernmost counties in Vermont and New Hampshire, Montana, Idaho, and other places are having another surge because as winter has set in, temperatures have dropped, people are going inside, they're not wearing masks, and now we're seeing more COVID. And I think that's going to be the fear.
Yeah, I mean, I think it is that, and I think it's about risk tolerance and what can you do and how can you do, because we all want to get out to do some of those things that we did in 2019 as compared to last year and this year. What is your risk tolerance and what can you do to decrease that risk? Are you watching the daily cases, the 7-day rolling average? Are you fully vaccinated? Have you gotten a booster? You're taking those things all into account. Also, are you going to be meeting with people that might be higher risk? And so you really need to keep yourself safe in that context so you don't spread it to them. So I think there's a lot of details to really understand if you're talking about, can I go out to eat and to a restaurant and gatherings and things of that nature. Just understand, if you go to those larger gatherings or those indoor places, there is likely somebody there who has the infection. There are likely a number of people there who have not been vaccinated. So I think those are important things to take into account.
All right. Well, this has been a great discussion, and what I would hope is that people don't think we're just trying to be the doomsday doctors. How about that? The doomsday doctors. The reality is we are not part of the doomsday device, Star Trek episode, original series, but rather we are trying to give you the information that you need to keep yourself, your family, and your loved ones safe this winter and through all the holiday seasons. Final thoughts, though, from our guest, Mikayla. Again, I want to start with you, but I want to start by saying thank you.
Absolutely. Thank you. Thank you guys for all you're doing.
Final thoughts that you have from today.
I guess the thing that I kind of want to leave you all with is that I know that there are other people out there who contracted COVID-19 and who are having strange symptoms and maybe feel like they're making it up or feel like it's in their head, or maybe they've had other doctors who have dismissed their symptoms or told them that it was just anxiety, et cetera. And I just want to encourage those people that you're not crazy and you're not making it up. And the post-COVID clinic at KU Med has been a game changer for me, and that there is help available.
Oh, we lost her again, but we totally, and can I just say, I think this is really important because people feel isolated with disease, and when they feel isolated, they get depressed. And I think it's really, what you've talked about around that is really important. And to Dr. Comfort, thanks to you and to all of the team. I know there's a lot of physicians and nurses and physical therapists and respiratory therapists and social workers all involved in the long haul clinic. I just, that's got to feel so comforting to patients to have a home. And to have a home means everything. Because hope means everything.
Yeah, and it's great to hear that. And I would just say, Mikayla, you are a very impressive person. So all you've been through and all that you're doing, it is amazing how far you've come. And we do have a great team here. And I think we have a lot of different doctors involved in the post-COVID clinic. Many of them are doing this on kind of their own time or extra time or whatever. They're doing it because they care and they want to serve the community. And so it's been a good resource, I think, for patients like Mikayla and otherwise. And I take a message of hope out of this. I really do. So many of our long-haul patients, for all that they've been through, they start losing hope in this. But I think day in, day out, if you kind of put in the hard work, go through the therapy, over time, people are starting to get better. And I think Mikayla's told that story so well today.
And I'll just say, it's a pretty personal experience with the POTS, and man, that physical therapy means everything. So thank you, and hope. Another one. You know, one of these days we're going to have to go through all my ICU and all my medical rules. But another one is that hope brings hope, because if people find a little bit of hope, then they themselves have it, and that helps them cope. So hope brings hope, and hope brings cope. So, okay, Hawkeye.
Well, you know, a lot of people are getting their medical research and advice from Facebook and Twitter. You could probably post that stuff on them.
Yeah, I probably could. I wonder what happened to it.
Well, I'd like to thank our guest here, and I think it is so great that she did get vaccinated. We learn more and more, and the data continues to support the fact that if you get vaccinated after you've been infected, you have more neutralizing antibodies, and you actually have neutralizing antibodies to all the variants as compared to those people that just got infected and have not gotten vaccinated. So you actually get that better immune response after vaccination, after you've had infection. So I would encourage everybody to go get vaccinated, even if they've had the infection. We hear that question come up all the time. But it is very important because it allows your immune system to further expand and evolve to help tackle and be able to neutralize the variants of concern that we know about, and more than likely those variants that we don't even know about. But I'll also like to point attention to this week is International Infection Prevention Week.
All right, yeah. I like it.
And, you know, Steve, Infection Prevention Week has been around since 1986, so infection prevention is not new. We've been dealing with it for a long time. We do have a little graphic up here. This is provided by our infection prevention group, which is called APIC. It's our national group, and it just has these 10 ways to prevent infection. So obviously in that 1 o'clock spot is the biggest one. Wash your hands often. There are several other things as you go around the circle. I like the third one as well, get vaccinated. That's essentially important. Down near 6 o'clock is practice food safety. We know that we want to cook and clean things appropriately. Stay home if you're sick. That's very important down there. And then probably my favorite one, although get vaccinated may be up there, but my favorite one is keep your personal items to yourself, i.e. try not to share toothbrushes. I certainly work on that on a daily basis. So,
I hope so.
That's important as well.
You've never offered one to me.
That's right.
Well, and just to say, masking's been around for a long time,
It
too.
has.
So it is not new. Part of medicine is the art of medicine as well as the science of medicine. I remember a patient who came to see me a very long time ago now, and she had been given a diagnosis, and they told her that she only had weeks to months to live, and she should get her affairs in order. And the first thing you had to do when you met with that patient was to provide hope. Because, again, hope helps cope. Hope brings hope. And, that person's alive today. And that was about 20 years ago. So I think the message we all have to remember with COVID and with long haul syndrome is that we are getting new things happening every day, and that through research and science, we can help bring hope. And with hope, we can all cope a little better, because the end of the pandemic can come about. It does take all of us. It takes hope, it takes coping, and it takes a lot of work. But that's a story of recovery from long haul syndrome. That's a story of recovery from a lot of medical illnesses. And it is going to be the story of recovery from COVID-19. We've got to go with the science. We have to work at the outcome we all want. Thanks for being with us today. Tomorrow, you can't go a day without feeling some sort of pain, whether it's from COVID-19 or those from diabetics suffering from neuropathy. Now there's help on the way thanks to a newly approved pain stimulator. A look at how it works and why, for one man, he's now getting the relief he needs. That's tomorrow at 8 a.m. Don't forget, you can catch our shows anytime on FaceTime and YouTube. Go out, make it a great day, and remember, hope means everything. We'll see you tomorrow.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.
Thank you so much for joining us this morning for this Best of Morning Medical Update. You can catch our live broadcasts every Monday, Wednesday, and Friday. And don't forget, you can always email us at medicalnewsnetwork@kumc.edu or reach out to us on Facebook, Twitter, and YouTube. We will be back to our live shows 5 days a week starting September 6th. So please go out, make it a great day.